أهلا وسهلا بكم مشاهدينا الكرام من جديد، ويسرنا أن نلتقي عبر الفيستايم مع الدكتور راجيش الالسكندر من جمهورية الهند الصديقة. First of all, Doctor, welcome to our show. Good evening, Kuwait.
Thank you, Aziz. It's my pleasure to reach out to you and your viewers.
And the pleasure is us. First of all, Doctor, what did you do in this pandemic?
Well, our organization's Indian Dentist Alliance in Kuwait was formulated in the year 1997, and we are affiliated to the Kuwait Dental Association. Though we were associated in community outreach programs to the weaker sections of the society, this COVID-19 pandemic actually gave us a different perspective and an opportunity to shoulder our responsibility to our dear brothers and sisters from the weaker sections of the society at a deeper level. One area of shortage they faced was in regard to the food. That is when our organization wholeheartedly decided to help the people in need. To start with, the first call actually came from Dr. Aisha Al-Sumait, the director of School Oral Health Center at Al-Jabar Hospital, when she informed us whether we could provide any food relief to the Julaya Military Quarantine Center. And we finally decided that we were supplying them with 6,650 food packs, along with 383 basic oral hygiene kits and 4,000 packs of mineral water. This effort was coordinated by Major Dr. Mohammad Al-Sabri in Julaya Military Quarantine Center. And next in line where we supplied the food packs was to the Saban Quarantine Center, which is a military base, where we provided 150 basic essential food kits and basic oral hygiene kits, along with 1,770 mineral water packs. In Mishraf Quarantine Center, we were able to provide 4,000 mineral water packs. Next in line in our charity was to the KGL Doha camp, where we provided them with 143 food kits. In residential areas of Mangap, Melbola, Abu Alifa, and Melbola, we were able to provide them with 180 food kits. Along with this, other residential areas like Kab, Rigai, Sura, Abbasia, Parwania, we were able to provide about 676 food kits. And the last in line where we were providing charity was in Salmiya and Haveli, where we supplied about 111 food kits. So I would like to take this opportunity to thank our well-wishers who supported us in the noble venture, namely the Oriental Group of Residents, ETC Group, the Indian Women's Association, the Grand Hypermarket, the MES Organization, and Goodfield Group, and all the like-minded friends who supported us in this noble venture. Thank you.
You're most welcome, and also we appreciate and gratitude your efforts and everyone who's working in the first line, and thank you for thanking all the sectors in Kuwait, from the private and also the public sector. Thank you so much for sharing this amazing information for everyone who's watching us through the KTV1 the main channel. أنا سألت الدكتور راجيش الكسندر من جمهورية الهند الصديقة ماذا فعلت في هذه الجائحة، وأجاب بإسهاب أنه عمل على توزيع المؤن الغذائية على المحاجر الصحية. It goes me to another question, our guest, Dr. Rajesh, because you're already mentioning about the oral health. So what about the impact of COVID-19 on it?
Well, dental professionals of the world are going through an unprecedented time due to this COVID-19 pandemic, and Kuwait is no exception to that. There are a lot of confusion and fear among dental practitioners all around the world as to when they can resume their work and the kind of precautionary measures one needs to take. However, we are conscious that national social distancing policy still remains in place. Therefore, all measures to mitigate the risk of transmission of the virus via dentists must be taken in providing care and should be of paramount concern to the safety of our staff, patients, and ourselves. As we are slowly limping back through a phased restart of dental clinics in government and Ministry of Health, and the private sector in Kuwait. Very strict guidelines have been laid down by the Dental Administration, Ministry of Health to be followed.
Okay, and thank you so much for sharing this information for everyone who's watching through the KTV1 on this live stream and people taking benefits from the oral health. Let me translate for our dear viewers. أنا سألت الدكتور راجيش الالسكندر ما هو تأثير مرض كوفيد 19 الفيروس على صحة الفم، وأجاب بما أن الفيروس ينتقل عن طريق الفم فمن الضروري تطبيق الإجراءات الاحترازية للوقاية من هذا المرض. Now let's focus more about the state of Kuwait, our beloved country. How do you see the precautions and procedures in the state of Kuwait to contain the virus?
Well, it's with great pride that I can say that with utmost confidence that Kuwait is one of the few countries in the world which came with proper implementation guidelines to be followed in the wake of this pandemic. On that note, even before this pandemic, Kuwait has been one of the foremost countries in the world where the quality of dental treatment is above or better than most developed countries in the world. The key to this success goes to the right leadership under the able guidance of Amir, His Highness Sheikh Sabah Al Ahmad Al Jaber Al Sabah, Crown Prince Sheikh Nawaf Al Ahmad Al Jaber Al Sabah, and all the government officials in all the ministries for the relentless work they have carried out to keep this pandemic at bay.
Thank you very much, and thank you for sharing this information to us and everyone who's watching us in this Good Evening Kuwait show. أنا سألت الدكتور ما هي الإجراءات والاحترازات التي اتخذتها دولة الكويت لاحتواء الفيروس، وأجاب أنه أثنى وشكر جهود دولة الكويت وعلى رأسها حضرة صاحب السمو أمير البلاد الشيخ صباح الأحمد الجابر الصباح حفظه الله ورعاه، وسمو ولي العهد الشيخ نواف الأحمد الجابر الصباح حفظه الله ورعاه، والحكومة الكويتية والشعب الكويتي على جهودهم لاحتواء الفيروس. Now let's talk more about the citizens and residents. So how do you see their commitment in medical procedures, doctor?
Well, it is no different. What has been of important criteria to all the people of this country is the government as well as the government officials have implemented a strict guideline that need to be followed in all the private hospitals, the private health centers, the government hospitals, the government clinics. One of the foremost thing that has been carried out by the ministry is all the centers pertaining to the ministry have been given a set of guidelines which has to be followed. And even in the private dental centers, dental hospitals, and the medical hospitals, there has been a strict guidelines that has been issued by the government of Kuwait under the Ministry of Health, and it is up to all the citizens and the dental healthcare professions and the medical care professionals to maintain a high quality of standard during this COVID-19 pandemic.
Thank you so much, and also we will overcome this disease soon. أنا سألت الدكتور راجيش ما رأيك في التزام المواطنين والمقيمين في الإجراءات الصحية، وأجاب أن المواطنين والمقيمين ملتزمون في الإجراءات الصحية ويعملون يدا بيد لاحتواء الفيروس. Now let's focus more, doctor, to highlight about the importance of medical awareness to prevent the disease.
First and foremost, my humble request to each one of you is to strictly abide by the medical protocols laid down by the Ministry of Health Kuwait and the social guidelines laid by the officials of the government of Kuwait. Always maintain a minimalistic approach to a strong slogan that social distancing should be practiced and avoid related traveling unless and until it is that urgent. On that note, most important criteria that has to be looked upon by the layman is the basic the cleanliness parameters that need to be followed in the form of use of face masks. Whenever people go outside in public space, always use a face mask. And secondly to this is, whenever it is essential, if provided, always use the hand sanitizer, or if it is possible for you to wash your hands, that would be the best.
Thank you very much. Let me translate to our dear viewers. أنا سألت الدكتور عن أهمية التوعية الصحية للوقاية من المرض، وأجاب بإسهاب أنه شيء مهم يزيد من حالات الشفاء ويقلل من حالات الإصابات، وأجاب عن بعض الإجراءات الصحية للوقاية من مرض الكورونا، وهي غسل يدين لمدة لا يقل عن 20 ثانية بالإضافة إلى تعقيم اليدين. Let's go me to another question now, because you're already mentioning about the health awareness to prevent the disease. So let's go from health awareness to social distancing. So how about the benefits?
Well, social distancing has a lot to do in this COVID-19 pandemic, because one of the utmost importance that need to be understood by the the people of this country or elsewhere is through social distancing, we are trying to completely stop the unwanted entry of infection to a person. We have to be those people who are from the older age group and who have got comorbidity has to be extra careful so that social distancing, if correctly followed, can go a long way in stopping the rapid spread of this COVID-19 to the community stage.
Nice, and thank you so much for sharing this brilliant information for everyone who's watching us through the KTV1, especially the main channel on this live stream. أنا سألت الدكتور عن أهمية التباعد الاجتماعي وأجاب بإسهاب أنه من أهم الإجراءات الاحترازية للوقاية من المرض. It goes me to another question, doctor, because you're already mentioning about the social distancing. Let's focus more about our bodies now. How can we enhance our immune system?
Basically, that is one thing that is going around all the areas of public interest. Well, the most important thing is what goes in regard to increasing your power in the immunity, your immunity power. The basic thing what need to be done is to go through a very balanced diet, do a lot of exercise whenever it is possible. If it is very hot, you can always go in the early morning or in the evening. But see that a good balanced diet with complete restrictions on social habits like smoking and unwanted other related habits goes a long way in trying to build up your immunity. So all precautions and measures should be taken by every citizen of this country and the public so that the immunity is not compromised and he or she is protected in every way.
Nice. Let me translate this brilliant information for our dear viewers. أنا سألت الدكتور راجيش الالسكندر كيف نحسن من مناعة الجسم وأجاب عن طريق ممارسة الرياضة والإقلاع عن التدخين وبالإضافة إلى تناول الأطعمة الصحية. Because we're already mentioning about our immune system, doctor, let's focus about our lifestyle now because we're already facing this crisis for approximately now 4 months. So is this crisis change our lifestyle in medical way, doctor?
Yes, one of the things that need to be understood as what was your present era and what need to be followed in this COVID-19 pandemic is I would advise a minimalistic approach on everything. Especially as I told you, don't go out unnecessarily. If you need something very urgent, do it. Otherwise, be at home, take care of yourself and your family. Otherwise, I wouldn't advise anybody to go out unless and until it is that an emergency. And especially, I would like to stress the important factor that old age group and patients with comorbidity, people who have got any other systemic illness, they should be extra careful in trying to limit themselves so that they prevent any aggravating factor for the COVID-19 to be infected with that.
Okay, let me translate to our dear viewers about the new lifestyle as you already mentioned to the viewers. أنا سألت الدكتور هل الأزمة غيرت نمط الحياة المعيشية وخصوصا من الناحية الصحية وأجاب بالفعل. ففي الوقت الراهن نحن نستخدم المنصات الافتراضية عن طريق التواصل مع الأشخاص عن طريق وسائل التواصل الاجتماعي بالإضافة لعدم الخروج إلا للضرورة. Now it's time for our important question, doctor. Can you send the message to the viewers in your own language?
പ്രിയപ്പെട്ട എൻ്റെ നാട്ടുകാരൻ, എനിക്ക് ഒരു കാര്യമേ പറയാനുള്ളൂ. ഈ ഒരു സമയത്ത് ഈ രാജ്യം തരുന്ന അല്ലെങ്കിൽ രാജ്യത്തിൽ ഏറ്റവും വലിയ ഹയസ്റ്റ് ഒഫീഷ്യൽസ്, അത് മിനിസ്ട്രി ആണെങ്കിൽ ഗവൺമെന്റ് ഒഫീഷ്യൽസ് പറയുന്ന എല്ലാ പ്രോട്ടോകോൾസും നമ്മൾ മെയിൻറ്റെയിൻ ചെയ്ത് മുന്നോട്ട് നമ്മൾ അവരുടെ കൂടെ നിന്നാൽ മാത്രമേ നമുക്ക് COVID-19 തോൽപ്പിക്കാൻ ഒക്കത്തുള്ളൂ. അവർ പറയുന്ന പോലെ ഏത് സമയത്തും വെളിയിലോട്ട് പോവുകയാണെങ്കിൽ ഒരു ഫേസ് മാസ്ക് ഉപയോഗിക്കുക. അതുപോലെ തന്നെ ഒക്കുവാണെങ്കിൽ സൗകര്യങ്ങൾ കിട്ടുവാണെങ്കിൽ ഒരു ഹാൻഡ് സാനിറ്റൈസർ അല്ലെങ്കിൽ ഏത് സമയത്തും കൈ കഴുകുക എന്ന് പറയുന്ന ഒരു ഇത് മുന്നോട്ട് നയിച്ച് ഈ രാജ്യത്തിന്റെ ഒഫീഷ്യൽസിന്റെ കൂടെ അവരെ സഹായിച്ച് നമ്മൾ ഇതിനെ ഈ COVID-19 പാൻഡമിക്കിനെ നമ്മൾ എങ്ങനെയെങ്കിലും നേരിടണമെന്നാണ് ഞാൻ എല്ലാവർക്കും പറയുന്നത്.
Thank you very much for accepting the invitation for our show. Good evening Kuwait. كان معنا الدكتور راجيش الالسكندر من جمهورية الهند الصديقة، وملخص اللقاء أعزائي المشاهدين دار حول ماذا فعل في هذه الجائحة، بالإضافة